If HIV positive patient walks into a clinic with severe pain, would you just skip the treatment just by writing a prescription or complete a treatment and show off his pain? What code of medical ethics says? There shouldn't be any discrimination in kind of any gender or any kind of religion, caste, creed. It's not acceptable to reject a case based on the risk of the contamination for the healthcare personnel. I do agree safety is the prior importance for a healthcare professional, but you need to follow some guidelines just before treating such patients. Basically, these people are immunocompromised. They are prone to secondary infections and all, and the healing capability is delayed. They have a high risk of bleeding even. Certain pre-operative investigations should be followed before starting the treatment. One such thing is to evaluate the CD4 count. Basically, these CD4 cells are involved in immune modulation. So when CD4 count drops below 200 cells per cubic mm, there are chances that these individuals may prone for secondary infections, delayed wound healing, and the risk of dry socket is higher. And you also need to check for HIV count, that is the viral load. If the viral count is less than 20 to 50 copies per ml, the patient is better to go for extraction as the viral load is lesser and patient is having the good response for antiretroviral therapy. And the risk of transmission is much more lesser when compared to the higher viral load. You also need to check for complete blood picture and to evaluate the absolute neutrophil count, because these are the first line of defense for any infection. Absolute neutrophil count is less than 500 or 1000 cells per mm cube. Then you need to put the patient on antibiotic prophylaxis prior to the treatment. And you also need to check for the platelet count, prothrombin time, activated partial thromboplastin time before extraction treatments. If patient is having a test reports of CD4 count within 12 months, there is no need to go for a rechecking. Just like that, if the viral count test is within 6 months, there is no need to go for any re-evaluation. So these individuals have chronic oral lesions like oral hairy leukoplakia. They are highly prone for candidal infections, fungal infections, acute necrotizing ulcerative gingivitis, a periodontal condition. And every dentist should keep this kind of a PPE kit compulsory in your clinics, just to prevent the cross-contamination for your staff. Strict adherence to these PPE protocols using protective eyewear and all will ensure proper infection control and safe dental procedures in your practice. And the next video will be on the disinfection protocol that need to be followed after the treatment of a high-risk individual. Stay tuned.